Hello and welcome to the next edition of the BriefingsDirect Voice of the Customer podcast series. I'm Dana Gardner, Principal Analyst at Inter Arbor Solutions, your host and moderator for this ongoing discussion on digital transformation success stories. Please stay with us now as we learn how agile businesses are fending off disruption in favor of innovation. Our next business transformation use case examination discussion focuses on how an ecosystem approach is bringing improved healthcare informatics outcomes. We'll now learn how Philips Healthcare Informatics and Hewlett Packard Enterprise partnership is combining to create new solutions for the global market and provide better healthcare outcomes. Here to help us learn what works as major companies tackle the complexity of solutions delivery in healthcare and using big data and analytics to its extreme, we're joined by Martin Heemskirk, Healthcare Informatics Ecosystem Director for Philips, based in the Netherlands. Welcome, Martin.
Thank you for having me. Nice to be here.
We're glad you could join us. So why are partnerships so important in healthcare informatics? Is it because there's clinical considerations and data and technology? Why are solutions particularly dependent upon an ecosystem in this regard?
Yeah, it's exactly like you're saying, Dana. As Philips, we are very strong at developing clinical solutions for our customers, but nowadays you see that those solutions require also an IT infrastructure layer underneath to solve the total equation. As such, we're looking for partners in the ecosystem because we as Philips, we recognize that we cannot do everything alone. We need partners in the ecosystem, as I said, that can help address the total solution or the total value proposition for our customers.
And I'm sure it varies from region to region, but is there a cultural barrier in some regards to bringing IT, cutting-edge IT in particular, into healthcare organizations? Or is that the old story? Have things progressed where technology and healthcare are more converged?
I think what you see is, of course, there are countries that are more mature than others. So the level of healthcare and the type of solutions that you're offering to different countries may vary. But in principle, many of the challenges that the hospitals are going through are very similar. And also some of the not so mature markets are trying to leapfrog so that they can bring different solutions that are up to par with the mature markets.
Mm-hmm. Because we're hearing a lot about big data and edge computing these days. We're seeing the need for analytics at a larger scale. Maybe you could, for some of our listeners who are not that familiar, explain how big data is changing healthcare these days.
Yeah, so I think for big data, what is very interesting, if you combine it with value-based care, for instance, it's a very interesting topic. Nowadays, a hospital is not being reimbursed for every step that it's doing in the hospital, but it's looking at the total outcome of how a patient is recovering. That means that more analytic needs to be done in different elements of the chain before reimbursement will take place. So in that sense, analytics becomes very important for hospitals to measure. Are things being done efficiently? Are the costs still okay for a hospital, for instance?
Mm-hmm. Yeah. And it seems to me that the same data that they can use to be more efficient in their economic and utilization and productivity can also be used for better healthcare outcomes and understanding the path of disease, the efficacy of procedures, and that sort of thing. So a great deal can be gained when data is gathered and used properly.
Yeah, that is correct indeed. And you see indeed that there's much more data nowadays, and you can utilize it for all kind of different things indeed.
All right, so maybe you could help us understand the relationship between your organization and HPE, where your part of the value begins and ends, and how HPE fills their role on the technology side.
Yeah. So from already quite a long time, HPE is a very valued supplier of Philips. We use their technologies for all kind of different clinical solutions. So for instance, all of the hardware that we use for our, for instance, PACS solutions or advanced visualization is sourced by HPE. I'm focusing very much on the commercial side of the game, so to speak, where we're really looking at how can we jointly go to market. As I said, customers are really looking for one-stop shopping, a complete value proposition for the challenges that they're facing, and here is where we're really trying to partner with HPE on a more holistic level.
And so does that involve you or bringing HP into certain accounts and vice versa, and then going in together? So I guess a full spectrum of opportunities depending on the market requirements.
Yeah, that is exactly the case indeed. So what we recognize is that we're not so much focusing on, for instance, problems related to the clinical applications, or we're focusing on the problems that HP is facing on the IT infrastructure or on the connectivity side of the value chain. We're really looking at the problems that C-level are facing. And so you can think about consolidation, for instance, is a big topic. Many hospitals are now moving into a cluster or into a network, and that creates all kind of challenges, both on the clinical application layer but also on the IT infrastructure. How do you harmonize all of this? How do you standardize all of your different applications? How do you make sure that hospitals are going to be connected? How do you align all your processes so that there's a more optimized process flow within the hospitals? By addressing this and jointly going to our customers, we think that we can create better user experience for the customers. We can create better service. We have optimized solutions, and we have a lot of time savings for the hospitals as well.
Mm-hmm. Well, we've certainly seen in other industries that if you try to go about IT modernization without including the larger organization, the people, the process, the culture, that the results just aren't that good. So it is important to go at modernization and transformation, consolidation of data centers, for example, with that full range of inputs and getting buy-in. So how does that work? Do you all have other partners that specialize in medical industry, business issues? I guess I'm looking for more names or participants in the ecosystem. It takes more than two players to make an ecosystem.
Yeah, that's very true indeed. I think in this whole play, system integrators also have a very important role. They can have some kind of an independent view on what would be the best solutions that fit for that hospital. Of course, we think that the Philips solutions quite often are the best, jointly forced with the solutions from HPE, but can from time to time also be that you're partnering with different vendors. Besides that, we don't have all of the clinical applications, so sometimes we're partnering with other vendors in the ecosystem. But you can also think about enhancing some of the solutions that we have. Think about 3D solutions, 3D printing solutions. Nothing else comes to mind quickly, but you can think about those kind of things.
Sure.
Yeah.
All right. Do we have any sense, Martin, on some of the results, the paybacks? I know you can't always mention names or get too specific, but when you do this correctly, when you leverage and exploit an ecosystem approach, when you cover the bases of technology and finance and culture and clinical considerations, how much of an impressive improvement can we see?
Yeah, so we try to look at it customer by customer, but generically what we see is that there are really a lot of savings for the customers. First of all, by addressing standardization across the clinical application layer means that a customer doesn't have to spend a lot of money on training all of its hospital employees on different kind of solutions. So that's already a big saving. Secondly, by harmonizing and making better effective use of the clinical applications can drive the total cost of ownership down. Thirdly, it means that on the clinical application layer there is a lot of efficiency possible. Advanced analytics make it possible to reduce the time that clinicians or radiologists, for instance, are spending on analyzing different kind of elements, which also creates time savings.
Mm-hmm. All right. Looking more to the future as technologies improve, as costs go down, as they typically do, as hybrid IT models are utilized and understood better, where do you see things going next for the healthcare sector when it comes to utilizing technology, utilizing informatics, and improving their overall process and outcomes?
So what for me would be very interesting is to see if we can create some kind of a patient-centric file for patients. So you see that consumers are increasingly engaged in their own health. So all of the different devices like Fitbit, Jawbone, Apple Watch, etc. are coming up. This is creating a massive amount of data. But there is much more data that you can put in such a patient-centric file. With the chronic diseases, people are being monitored much more and much more often. If you can have a chronologic view on all of the different touch points that the patient has in the hospital, combined with the drugs that a patient is using, etc., and you have that in this patient-centric file, that would be very interesting. And everything, of course, needs to be interconnected, so IoT will become more important. And as the data is growing, you will have smart algorithms that can also interpret those data. So artificial intelligence, for instance, will become much more important.
Well, very good. I'm afraid we'll have to leave it there. We've been exploring how an ecosystem approach is bringing improved healthcare information benefits, and we've also learned how Philips Healthcare Informatics and Hewlett Packard Enterprise are in a partnership that combines their forces to take these solutions out to the market, to the global healthcare field. So please join me in thanking our guest. We've been here with Martin Heemskerk, Healthcare Informatics Ecosystem Director for Philips, based in the Netherlands. Thank you, sir.
Thank you very much, Dana, for having me.
And a big thank you as well to our audience for joining us for this special BriefingsDirect Voice of the Customer Digital Transformation Success Story. I'm Dana Gardner, Principal Analyst at Inter Arbor Solutions, your host for this ongoing series of Hewlett Packard Enterprise-sponsored interviews. Thanks again for listening, and do come back next time.